Today, we welcomed back Dr. Dargie, who is a medical director and the CEO of the Botox course. Like, what a title. I love this guy. We've had him on. This is the second time that we've had him on. And today's episode was so awesome. We really just dove into myth debunking about all injectables and the different kind of injectables that are out there and who the best candidates are for them. It's just like such an easy conversation. I learned so much today, especially about different trends that are we're seeing all over the internet and just really he brought it back to basics of what injectables are, the benefits and the limitations. And it was just such a wonderful conversation. I learned so much. And I just think that everyone who listens to this episode will also learn.
I know, I agree, Natasha, because there's just today we're living in a world of trends and a lot of social media influence of what to do, what not to do as a generalization. And I think that when you're getting into injectable procedures, you need to understand anatomy. You need to be going to somebody who knows what they're doing. And what I really like is he's got a very nice human approach to it, a really
Yeah.
caring patient and doing the right thing for the patient and taking into consideration all aspects of life, whether it be their age, lifestyle, diet, and, keeping it authentic in the way that if somebody shows up in his chair and they're not a candidate and they're requesting it, he's not going to do it. So the value system around not just trying to sell something to somebody, but to perform and give procedures based on integrity somehow. And I really
Yeah.
like that. I love his approach about that. So welcome Dr. Dargie to the podcast.
Dr. Dargie, we are so excited to have you back on today's episode. Last time we spoke about so many different things, and today I really want to dive into some fun topics, really kind of surrounding a bunch of different things that you are doing, which is injectables, sculpture, et cetera, et cetera. But you, before we get started, just to give a brief introduction to our listeners, you are the CEO of the Botox course. Can you quickly just give us um, the insight of what a Botox course is? Like, what is it so that people are listening can kind of understand?
Well, first of all, thanks for having me back. I couldn't have bombed the first one too bad if you guys are having me out here again, so thank you. For my background, I'm an aesthetics physician, and 6.5 years ago, we founded the Botox course, which is the top aesthetics training program in the country, period. No one comes close. That's the honest truth. We offer more hands-on training than any other program when more experienced injectors as educators. So, we offer a number of different trainings from toxin training to HA training to our newest program, the Regenerative Mastery Program, which is a new state of the art. No one in the industry does it, where we created a program where there is a 3-to-1 educator to learner ratio. Everyone that comes gets a cadaver lab at that same ratio. They get the most expensive lawyer in the country talking to them about aesthetic medicine. Top business consultants coming in, they get to do hands-on full body sculpture and radius training, hands-on thread lifting training, and more. And at the end of it, they get their full tuition reimbursed in injectables product that they need to buy anyways to do the procedures. So we've made education that's effectively free. So that's a little bit about my background. I own and operate 2 clinics in Western Canada and teach around the world.
Amazing.
And
That's like it's
right now you're on a tour, right? You're originally, like you said, from Western Canada, but you said you're in Halifax now, right?
Yes, we are working our way across the country. So we have programs in Halifax, Toronto, Montreal, all out on the East Coast.
Excellent,
Oh, I
excellent.
was going to ask if you had one in Montreal. I'm curious.
Yeah, because of the French language, right? Like it's
Yeah.
always the place that's a little bit more difficult or challenging for people
Ouais.
because of the fact that everything has to be in French here. So
Yes.
yeah, so that's really cool. Thank you for joining us today. We always love to have these
Yeah.
conversations.
So, obviously, considering you are the CEO of the Botox course, you know so much about injections and there's so much information out there. Like, let's just start with the basics. Like, can you give us a couple benefits and limitations to injections? And then I guess also like define what injections means because for somebody it can mean Botox, somebody else it could mean um, fillers. Like, what are your definitions of injections? What are limitations and benefits?
Certainly. So that's a broad question. And what I would say is
Mhm.
injectables just refers to medications or substances that people inject into their face for improved cosmetic effects. And so, specifically, maybe an easy way to break it down is there are neurotoxins out there like Botox, Xeomin, Dysport, Nuceiva. There's a whole bunch of them. These medications relax muscle, and it's muscle contraction that causes a lot of the fine lines on the face. And thus, if you use this molecule, you're able to prevent those fine lines from coming in. Then you've got volumizing agents, which are fillers. There's all sorts of different types out there, from permanent to semi-permanent fillers. Usually people are referring to hyaluronic acid-based fillers, and these are brands such as Belotero, Restylane, Juvederm. These are volumizing agents, and as we age, our fat pads change, our ligaments weaken, our bone recedes, and we lose volume in areas of our face, and these are great tools to replace that. Biostimulators are a hot topic these days.
Yeah.
These are medications that stimulate your own body's hardware to produce lots of collagen. And as we all know, collagen is really important for skin texture, for volume, for a youthful appearance. And then there's all sorts of other things for injections, whether there are fat dissolving agents such as Belkyra or Kybella in the United States, deoxycholic acid derivatives. There is PRF and PRP injections. There are so many different things that we can utilize and inject under the surface of the skin to improve our appearance and produce a nice cosmetic effect.
Mm,
Okay.
very interesting.
Interesting. I've never heard of biostimulators before. This is like the first time that I'm hearing it, which is interesting. So how does that like work? Like it's something that stimulates your own body to produce collagen. How does that work?
Yeah, you nailed it there. So there's two main biostimulants that people have heard of, Radiesse and Sculptra. And these have been
Mm.
around since 2004 and 2005, respectively, in Canada. However, when they were introduced to the market, not many people wanted to get into them as they are non-reversible. Whereas a hyaluronic acid filler, you can just break down if you don't like the results or you have a poor outcome.
Mhm.
And it just wasn't front line in the aesthetic industry. Now, these companies have both spent a lot of money on marketing, and people are looking for more natural results. And so the concept of stimulating your own cells to produce collagen naturally has been very appealing to people. And we've seen a surge of interest in this, particularly over the last 2 years.
Okay.
Okay. And like
How
where
does
would
it do that?
one do this
Like,
injection?
yeah, how does it work? Like,
Yeah.
So do you spit? Well, let me just get to this is that you can use these pretty much anywhere. And so, depending on how you reconstitute these, now these both work very differently. Sculptra is polyl-lactic acid, and it comes packaged, and you reconstitute it, and it is a suspension. So, if you think about one of those Christmas orbs that you shake up, and you have all of the snowflakes,
yeah.
that's effectively what you're getting with the PLLA, and it produces a subacute inflammatory reaction where your fibroblasts make a bunch of collagen. Radiesse, on the other hand, is calcium hydroxylapatite. And these microspheres are packaged in a syringe that looks very much like filler. There's actually a little bit of HA gel in this. And these microspheres stimulate your body to produce a bunch of collagen as well. And so they both require, I can get into the actual mechanism of action and how many treatments you need, but in terms of your question about where can these be used, these are used in many places, including the forehead, the temples, cheeks, mid-cheek, nasolabial folds. That's where they were first approved for use. Marionettes, jaw contouring, neck, hand rejuvenation, and there's been a great interest in buttock rejuvenation. specifically for hip dips or a little bit more projection and reducing cellulite. So there is a wide use of these medications.
So
Interesting.
does Radius and Sculptra basically do similar things? It's just a different ingredient kind of thing?
Yeah, different mechanism of action. So speaking about Radius first, and this is something I use a lot of in my clinic. Radius, both of these products require time to effectively work, but Radius works faster and produces a more immediate result because it has the hyaluronic acid gel as part of the syringe. So the general rule of thumb is if you're under the age of 40, usually one treatment produces a really nice result that lasts up to 18 months. And if you're over the age of 40, typically people require two treatments to produce a similar effect. Now, that's a very rough rule, but effectively, two treatments and you're going to be very pleased with your result. You can blend this medication with HAs and with neurotoxins to get combination effects, and there's data to support this. It's a really nice product. Now, Sculptra, you need to have at least 3 rounds of treatment to see a result. And again, you're going to get great longevity, 18 months to up to 2 years. But it is certainly not an immediate process and requires a fair amount of setting expectations as patients have to wait longer for them to see a difference.
So, you say that the results are non-reversible, unlike like hyaluronic acid fillers. So, what does that mean? So, in terms of the injector, and
Yeah, happy to talk to that.
yeah, like
Once it's in, you can't get it out.
yeah,
So one of the fears of these is that you could cause a vascular occlusion similar to how hyaluronic acid, if it's invested into a blood or invested in injected into a blood vessel, pardon me,
it's okay.
you can dissolve it with an enzyme called hyaluronidase. Now, these two medications, if they were to plug a blood vessel, there's nothing you can do about it. And so there is more risk when injecting these. Also, they both have different safety profiles. And one of the risks with Sculptra is subcutaneous papules or what can develop into collagen nodules. And in fact, I had a fairly significant collagen nodule in my forehead from a really talented injector. These things can just happen. And so once that's there, it's really hard to deal with. And despite a lot of people saying there are things you can do to reverse the process, that's just not true. It's time. Eventually they'll go away. But for that reason, they're considered non-reversible.
Oh, interesting.
Okay. So
And
you
now
really
you
need to make sure that the person doing this is like very, very well trained and very well practiced, right? Who's done a lot of experience makes a difference.
Certainly. Most people don't get into using these medications until they've been in full-time practice for at least 2 to 3 years. So in general, the aesthetic journey of an injector typically starts out with neurotoxin training. Then there's progression into PRP and HA training. And then it can be followed by biostimulation and at some point thread lifting training.
Okay.
Interesting. Now you said that the biostimulator can be used like in different areas, even on your body. Are there limitations of where you can use neurotoxins and also fillers as well? Like where on the face? Because I know that is this apparently this rule of thumb that you can't use Botox like below the face, but I just want to hear that's just a myth. I want to hear your take on that.
Yeah, I'll myth bust that completely. Not true.
Okay, good.
So neurotoxin can be used virtually everywhere. I mean, there's, you know, a number of on-label indications beyond cosmetic purposes. So it can be used to treat bladder overactivity in and amongst many other things like muscle spasticity throughout the body. So it's primarily used in the face and the neck. We get a number of requests to treat sweating under the arms or on the hands or the feet. So we do a lot of calf reshaping, shoulder reshaping with neurotoxin. Effectively, this works on muscle. And if you have a problem with overactive muscle, that's where you can use the medication. With
Okay.
hyaluronic acid, similarly, anywhere that you need volume, you could conceivably use these medications. Obviously, most common area is the face. There are certainly practices that focus on different areas of the body that you can use these things. And biostimulators, these are very commonly used in the face, the neck, in the back of the arms, on the knees, in the buttocks. I have it in my hands. You can really put it a number of different places to produce that collagen stimulating effect.
Wow, interesting. Because I did recently, like I when I heard that, I was like, "How that doesn't make sense." And then I saw this video of um getting Botox put into your like shoulders, or I guess like yeah, I guess your shoulders to help
One,
relax, I guess from somebody who has a lot of tension, right? And then I was just so confused because I was like, wait, it's not supposed to be used. And then I was just like, what's going on in my brain? Kind of lost
yeah,
it for a
like
second.
even migraines, jaw clenching, there's a lot of things that Botox is used for. And yeah, I wanted to talk to you about hyaluronic acid because I'm hearing a lot of things about hyaluronic acid right now, that people are moving away from it, that there's, in fact, in the face that it never goes away, where we understood at one point that it does slowly kind of disintegrate into the body or like absorbs by the body, but they're finding
Metabolizes.
cases and stuff like that for people many, many years after. What are your thoughts around all that? Because there's a lot of misinformation around that.
Yeah, we'll myth bust that one as well. That's
Yeah.
just not true. I think there is a sense of filler fatigue as during COVID, people spent a lot of money on these procedures, and frankly, a lot of injectors over injected people. And there's always going to be trends. However, HAs remain a very integral component to facial rejuvenation. You just can't produce a great effect if you completely take that out of your repertoire. In general, HA fillers, they break down. And so there are permanent fillers out there that will not break down, and some people still inject those. And also, there's a lot of injectors that are going to put filler in the wrong areas. And specifically, the tissue plane you put it in can affect longevity and the type of filler that you're using as well. And so, in general, these are very safe medications when injected properly. They don't produce, I guess, in sweeping terms, I think that they're mischaracterized as things that can be used to make people look unnatural. And the analogy that I would use is most of us work out and are relatively healthy. There's always going to be that one guy at the gym who's just doing bicep curls all day and taking steroids and looks greatly out of proportion. And the reality is, most people look completely normal in workout. And the same thing goes for hyaluronic acid fillers. Most people that get these, you would never know they had them. They just look refreshed and healthy. But certainly there's the Yaletown Classic, that walks around and you just, or the Kelowna Special. And, we know the clinics that those people are coming
Mhm.
from, where they're over injected, they're overdone, and they need to have a recalibration because their injector has taken them down the wrong turn in their aesthetics journey. So, in a long-winded way, fillers are great if used appropriately, and hyaluronic acid will break down.
Okay, and what about if you like, we often see these duck lips or like lips that have been misdone, and you can inject the dissolving agent. How long does that take to dissolve to correct?
Typically, it's reversed within a day. The
Okay,
enzyme works very
great.
quickly. You have persistent swelling from injecting it in. So typically, we like to see people back a week after doing it. But I do find in my practice, we do get a number of people that are coming in and they have been over injected elsewhere. And some people only want to try taking a little bit out. However, that's just not
Because you can't
possible.
precisely, yeah, you can't precisely
Yeah.
really take this and
So it's
not take.
better. Yeah, you're totally correct. It's just better to get rid of it and start with a clean sheet and a foundation and work your way up from there.
Hmm.
But there's like this thing where it's like this lip filler blindness, right? Where it's like you get like oh like you have this like really you have a client sometimes who just like overdoes it. Obviously, it's the injector that's also allowing the overdoing of the lip filler and doesn't say like, listen, it's a lot. But like, what are your thoughts on that? Because I mean, I had lip filler before. Been almost 2 years since I've done it. And I remember getting my lip filler and being like, oh, my lips look swollen and like great. And then they go down and then are like sad because your lips don't look like they got when you first walked out of the clinic. And I feel like that kind of like plays into this like lip filler blindness, and like when girls look at themselves and they're just like, oh, but like my lips don't look big anymore. Like, what are your thoughts on that? Because I feel like that's kind of like an issue with a lot of people.
Right. So I guess what you're saying in terms of blindness is not actual physical blindness, because
No,
some people
it's
say
like
you
this
can get, yeah, okay.
expression. Or like some people
Yes.
have like blonde blindness where they don't think they're blonde enough, or they don't think their hair's dark,
Yeah,
like it's like this blindness expression
I
that we
got you.
have.
So that is a big problem. And I certainly think that when you're looking at yourself in the mirror every day, sometimes people just are not picking up the changes. And that's where the injector is so important.
Yeah.
And particularly to what you referenced, a lot of people do see the swelling and they like that. And then the swelling goes down and they feel like they need more. And this is why I am very firm in my practice. You'll see a lot of clinics offer minis, what they call is, basically a fifth of a syringe, or some people a tenth of a syringe.
Mm.
In my mind, that's borderline criminal, because that zero point 0.1 or zero point 0.2 cc of HA is going to produce no cosmetic effect except swelling. So they're going to charge these people, you know, the margins on minis are better than they are on fulls if you actually add it up. And so they'll get these people, they'll basically poke them with no HA, because when you divide up zero point 0.2 into four quadrants of the lip, that's 0.05 cc's of a soft gel. That's effectively nothing. It
Yeah.
drives me crazy, because then these people get hooked and they just keep coming back and back and
Yeah.
back and back again to see any cosmetic effect.
We're doing it. Yeah.
Yeah, it's
It's
bad
misleading a
practice.
little bit too, right? It's kind of misleading, like you said. IS Clinical's active serum is my top pick for anyone dealing with breakouts, uneven skin tone, or texture concerns. This fast-acting and results-oriented formula is clinically proven to also reduce the appearance of fine lines and wrinkles. With a potent blend of ingredients like arbutin, sugarcane extract, bilberry extract, and mushroom extract, it delivers both rapid and long-term results. Just a few drops at night and let the results speak for themselves. If you want to try this product, go to bskinenvy.ca, that's spelled bskinenvie.ca, and use code SKINTALKS to get 10% off your first order. I have a question. I want to know about threading.
Mm.
Hit
Everything
me.
threading. Like, what is it? What does it do? Does it look
I see
natural?
s- I see
Like,
so many people online saying that it's not good.
Man, there is so much bad information out there. Sometimes I think it
Yeah.
would be good to just turn off the internet.
I'll
I
tell you why, because somebody said that I should do that. They recommended it to me, and I came back to the office. I said, yeah, I think I'm going to do threading. And Natasha said, no, you're not. You're absolutely not doing it. I'm not going to let you, blah,
No,
blah.
I just don't. I didn't think at this time she needs it. I think there's other things that she was doing that now the results have shown. I didn't think at that time that it was necessary.
Okay, but I just want to debunk it.
certainly. So threads have been around for quite some time. There are only a couple Health Canada approved threads. And so these are the ones that only medical professionals can access. Now, there is good evidence and data to support that these work to help lift tissues of the face. So I use these a lot in my practice. I am a KOL for both of the companies that have Health Canada regulated threads, and I can say that the effects they do produce lift when utilized correctly. So think of this in the most crudest form, like barbed wire. And
Yes.
you're going to slide this into the tissues and lift, and therefore the tissues cannot fall back to their regular place. And
I
it can
love it.
produce
I actually love it.
a
I love
nice
the thought.
subtle lift that lasts for approximately 18 months to 2 years. So specifically, if you think about the nasolabial folds, the marionette lines, or what most women are really bothered by, which is a little bit of jowling, which is totally normal.
Yeah, drives me crazy.
I'd say 5 years ago, there was a lot of people drinking the Kool-Aid of, let's put a whole bunch of filler back here at your
Oh,
gonial angle,
Yeah.
and that's going to cause lift. It's also going to widen you, and the amount you'd have to spend on that is a tremendous amount of money. When realistically, they don't need volume, they need lift. And so that's where I have the place for it in my practice, is for people that have deep nasolabial folds, that have already had cheek and filler, cheek filler, nasolabial filler, or they just are not going to see a difference from that. I will utilize threads to lift the tissues. And obviously, there is a great result that you can get with surgery, whether it's a neck lift or a facelift. This is fantastic, but there's a lot of people that either can't afford that or are not interested in undergoing surgery. And I think this is the niche area where threads can be very valuable.
So basically, you go in and you just like barbed wire, you hook, and then it lifts up. But is there any like deposit of hyaluronic acid or anything along the way that kind of helps to rebuild the collagen in the skin, or like the let's say the scaffolding?
Yeah,
That's
so both of these threads, they have biostimulatory properties and will actually stimulate collagen growth. So that's thickening the dermis.
yeah.
But the real effect of these threads is obviously to lift the tissues and anchor them so that you don't have as deep a creases or as much jowling.
So do you really see like in the definition of the jawline, do you see like dramatic change when you do this kind of thing?
Well, I'm cautious just with my verbiage because dramatic to some might be nonchalant for others. And so what I would say is it does produce a noticeable effect with a very positive outcome for people. So I like to use the word natural, and people certainly look a lot more refreshed after it. That's how I would position these products.
So what are your thoughts on all of these different, injectables that you have, combining them with other things like lasers and all the other modalities that are available in the market today to really work on skin rejuvenation and the texture, the color, the evenness, all of that stuff. Do you support that? Do you think that it's a good idea? Do you think people should be doing a combination of all and if they can?
Absolutely. So, I, as an athlete, I like to simplify things, how a track athlete might train for the Olympics. And if you just go to the weight room, you're never going to make it. If you just work on aerobic strength, you're not going to get anywhere. And, if you're not working on your flexibility, your nutrition, all of these different things factor into a really optimal result. And I think that people are mistaken if they think that one modality will give them or maximize the rejuvenation capabilities that are out there. So in my practice, certainly I'm a believer in, we have to assess the face as a whole. The skin barrier is super important. So recognizing what the right skincare products are is integral. Understanding how muscle impacts signs of aging on the face. Understand how the anatomy of the face changes as we age and what volumizing tools and agents and lifting things that we have out there, it also factors in, and certainly energy-based devices play a large role in that. And there is a wide range of machinery out there, whether it's dealing with pigment, texture, tightening, whatever that may be. There are so many different modalities in aesthetic medicine that I would say the more that you can utilize, the better.
Okay, great.
I have a question regarding two like at home things. I want to know your opinion on gua shaing, if that really helps lift the face, and also skin taping. Have you heard of this?
Are you talking about gua sha massage?
Yeah,
Yeah,
like do you
know
like there's
that.
a lot of people who do it for years or like every single day and they don't do Botox and they don't have the same movement as let's say like I do. And then there's this new thing as well. I don't know if you've heard this. It's called skin taping. So instead of doing Botox,
Yeah,
you basically have this like it's like a is it like a CT tape or something that you put
yeah.
different areas in that. Okay, I need to know your opinion on these two things.
Okay, I'll answer this diplomatically. With regards to massaging the face, in many ways, think of this. If your shoulders are really tight and you massage your shoulders, you're not going to have as much activation of your shoulders, right? And so you can make the same, I guess, case for relaxing muscles of facial expression. And I'm not one to judge. I do think that different modalities are going to benefit different people depending on their belief system. But overall, massage will not stop muscle contraction and it cannot produce the same effect as utilizing a medication like Botox.
Right.
N- Taping, I think that these results are very, very transient and anyone can make something look good for a short period of time. However, I am not convinced in any way that these can produce either a similar effect that's remotely as good as a neurotoxin for reducing muscle contraction or match the longevity of this.
Yeah, because
So
like I
you're
don't
not
understand
right?
this taping. Like I don't get like you would put it like let's say um
Eyelids,
your
eyelids,
yeah,
cut.
like or your like certain or your 11 lines like and I don't understand the concept of a tape. Like is there something in the tape that's like I don't understand. I see it all over TikTok and I'm like what's going on? Like I'm so confused,
I think it's just a gimmick. It's like
I think that you have your answer there. You found it on TikTok.
right?
I love that. I love that. TikTok wouldn't like that very much, but yeah, no, there's so many things that are out there, and like even just this whole glass skin technique, where you're going to bed with a sheet mask on that melts into your face, and you get up in the morning and you've got like this most beautiful, and I just think, everything, it's like these quick fixes that maybe have because your skin's been sweating all night underneath this mask, so you're more glowy and dewy. But after you wash your face and put on your skin cream, by 10 hours later, your skin's looking the same as it did the night before you put it on, right? It's all just very temporary.
Right. And I think that obviously aesthetics as a whole is something a lot of people are interested in. And thus, there is all sorts of different people trying to sell different services, maybe ones that would not be accepted by the medical community, and that's totally fine. Just as you're questioning it, I encourage everyone to question everything they hear in aesthetics, question me on anything you hear, and look for an evidence-based response. And a lot of people probably struggle to provide that.
Hmm. I think
Yeah, I think that's
we live
accurate.
in a world where marketing is like rampant, right? And
Mhm.
I think everything, not just in medical aesthetics, but generally just speaking, everything that we hear or fed through the news, through anything, needs to be questioned. It's a very good message right there, I think, especially today.
I want to know specifically, going back to injectables, like, um, who are the candidates for neuromodulators? Who are candidates for neuromodulators, neurotoxins, like HA? Like, how do you have somebody who comes in, like, how would I know everybody's different. I'm trying to like figure out how I'm asking my question, but like, who's a proper candidate for biostimulators, et cetera, et cetera? How do you determine that?
Certainly. So just break it down to what you need to under assess the face and look for symptoms. And then you need to not just treat the symptoms, you need to understand the cause. And that's what our objective should be. And so neurotoxin treatments, potato with neuromodulators. So you said it correctly. I effectively think that everyone who's an adult is a candidate for this. And certainly there are areas of the face that some people would want treated, while others would not need it treated. So this comes down to the injector. Relaxing muscle appropriately is good for cosmetic purposes. Typically, younger people, they're blessed with fat in their face that's very round and creates the signs of youth. And so obviously there is less need for filler at younger ages, but there's good evidence of how much, just switching over to collagen, we're losing 1 to 2% of collagen per year starting in our mid 20s. And making sure that we address that problem with medications like biostimulators is really important. So this is it sounds so cliche, but understanding the anatomy, understanding the aging process, and frankly, everyone is a candidate for all of these products. You just have to have that individualized, tailored approach to make sure that you are optimizing not only what the patient wants, but what you are seeing as you're equally yoked in this aesthetic journey together.
Hmm.
Right.
I did want to say something because I'm seeing a lot of, like, again, it goes back to TikTok and trends that we're seeing where we have, you have these young girls that are, early 20s, and they're talking about anti-aging in your 20s and all this kind of stuff. And I kind of feel like it's a little bit overdone in terms of, yes, we lose 1 to 2% collagen. Yes, we lose hyaluronic acid as we get older, but their focus a lot is just on collagen and not so much on skin health. And I find that I worry about talking about anti-aging when you're only 20 years old. I think it creates this narrative around fear and worry that like aging is a bad thing and that I don't know. I worry about all that and I see it a lot. Like you hear about these young teenagers that are like spending hundreds of dollars at Sephora and they're like so concerned with the age of their skin at such a young age. I just think it's like maybe the wrong kind of messaging around all that stuff instead of like talking about skin health and like ways to protect yourself.
So I understand what you're saying, and I share some of those concerns. I guess everything in life is about balance.
Yeah.
And, is the driver the cosmetic marketing out there? Is, the driver these platforms like TikTok, Instagram? What is causing this interest in aesthetics procedures? And I think we could debate that all day.
Yeah.
In general, most people want to look and feel their best at any age.
Yeah.
And so I think that's the role of a good injector is to help educate their clients, say no, tell them why they don't need certain things, make them aware of the other types of modalities, even if that's no treatment at all. And hey, you should be working more on your diet, or hey, why don't you work out first before we, treat this area? I think that because there's so much information out there, it's so important to get somebody who, and this is hard to find, is somebody that is not thinking about syringes and dollars, but overall thinking about their client and making sure that they're focusing on the right things in life. And I don't think it's wrong to think about appearance and looking and feeling your best, but it just has to be in moderation.
Yeah, we have to manage it in a way, because I see some like people on TikTok and they're like, okay, you're 20, so you need to be doing Botox, you need to be doing fillers, you need to be using retinol, you need to be doing peels. But I'm like, okay, but what about the skin barrier? What about the skin health? What about the like making sure the skin is
It is overuse. There's overconsumption
so
and
bad?
overuse of products that are ultimately not necessary at that age range, I don't
Totally.
think. Like,
Anyone that's throwing in you need these treatments, that's an automatic X, like
Yeah.
yeah,
red
red
flag,
flag.
get out of there, right? So
Oh.
yeah, certainly there's, as I said, there are people that are more interested in their own pocketbooks than the well-being of their patients, and that's wrong.
Yeah, I think so too.
Oh,
I like your comment just to close that is around the balance around it. And also to change the narrative around, aging being a bad thing. It's like I kind of feel it should be something that's embraced and celebrated as a privilege in a way, because a lot of people don't get to age, right? So just looking and feeling your best at every age of your life is and lifestyle, being healthy.
Yeah, I couldn't agree with you more. I think that, there's not too many things all humans have in common. And one of them is that we're all going to wind up in the ground someday.
Yeah,
And the reality is that it's tough. What my grandfather said, Andrew, it's tough getting old. And I see that in many ways, but it's also a great privilege in a sense with the experience, the life you get to live. And I think a lot of people, I was fortunate in some ways where I got diagnosed with cancer when I was 18 years old and had a very short prognosis and or life expectancy. And it really was a wake up for me. So things can be snatched from you in an instant. And it's been a good reminder of for me through my career that to enjoy and savor every moment as you go. And we're not trying to make people, we shouldn't be trying to make 70-year-olds look 20. We should be trying to help 70-year-olds just feel better.
yeah.
And that's the essence of what we should be doing.
I
And
love that. I love that.
And
Yeah.
that goes for 20-year-olds also though, because to feel like you look when you're 20, you're at your prime, right? But feeling good is also in your brain and is your mental state also. So I think the messaging around all that really needs to be around, you know, the mental part of it is also like important, I find.
Right. Understanding why your patient's in the chair is really important. And I teach this all across the country. It's not just about, hey, I want my lips bigger. Oh, yeah, yeah, let me help you with that. It's why are they here? Why are they feeling that way?
Yeah.
You know, do they actually, let me be your calibrator. Let me tell you your lips are actually perfectly fine. In fact, they're beautiful. Leave these alone. And the enemy of greatness is perfection. So don't chase too much. Reassure your patients when appropriate and be fair in your assessments.
I am loving Jan Marini's Luminate Eye Gel. I've been using it for months and it's my favorite product for tackling dark circles, puffiness, and crepiness. It's packed with retinol power, but gentle enough for everyone. And if you're dealing with milia, its gentle formula hydrates without being too rich. You apply it under eyes only and never on the lids. And remember, as with most retinols, there's an acclimation period. So start slowly, like 2 to 3 nights per week, and then gradually increase to every night. I promise you won't be disappointed. If you want to try this product, go to bskinenvy.ca. That's BSKINENVIE.ca and use code SKINTALKS to get 10% off your first order. Yeah,
I want
absolutely.
to sort of piggyback off of that and talk about baby Botox and like preventative Botox. Um, is that like, is this a, are we like myth busting this as well? Like, what's your opinion on baby Botox and like, is it really preventative Botox, etc.?
This term drives me crazy. I think that so many people in aesthetics, and I'd be cautious not to go on a little rant here, but so many people in
No.
Oh,
aesthetics are
pop
trying to
off.
find ways to sell product, right? And so many people are like, yeah, let's use as little as possible. This, I'm just gonna cut through this nonsense with this is a medication, dose to effect. I'm putting this on mugs for my learners. I've been preaching this, for nearly a decade. Dose to effect. Okay. So it's like if you need an antibiotic for pneumonia, you need a certain therapeutic amount to clear the infection. And if
Hmm.
you don't use enough, not only are you not going to fix it, the person may die, they can develop resistance to the bacteria or the drug, pardon me. So there is big harm in underdosing. And so what a lot of people say, whether it's because they're guarded financially or they feel some worry that their injector might take advantage of them or whatever that may be, this term baby Botox has taken off. And in general, all Botox should be baby Botox because we should be using the lowest possible dose to achieve a nice cosmetic effect that lasts. And so that is the takeaway is that baby Botox is just something to make this sound more palatable or sexy or play into some of the fears or worries or guilt that people may feel going in to get these procedures. But the reality is, most people in the industry are grossly underdosed. The average number of units for cosmetic treatment in the country are around 33 units. Now, I'm going to tell you a full face treatment is usually closer to 80 or 100 units for a full face of an adult female. Now, that's taking into account all the muscles. Most people don't get that. Most of my patients do. And so I'm always going to try and give, as I said, the lowest possible dose to achieve a cosmetic effect. Because if you just say, oh, I'm going to sprinkle 20 units in for your full face, nothing's going to happen. You've wasted the client's money and it's a complete disaster. You've done nothing. So that's where the term baby Botox is misused respectfully, in my opinion.
Mhm.
Respectfully, mic drop.
Mic
Yeah,
drop.
I was
What about like in a preventative measure? Like if you're in your 20s, should you start doing not baby
Botox.
Botox? We're gonna call it just Botox, or we're gonna start using neuromodulators in the face to prevent the formation of fine lines and wrinkles. Is that recommended?
At any age, neurotoxins or neuromodulators are used to prevent the signs of aging. So they are preventative in your 60s, they're preventative in your 70s. Certainly, you can be using these things to treat folds once they're there, but in general, the concept doesn't change. You're trying to prevent the signs of aging. So whether I have no problem utilizing it in somebody who's in their 20s who has very, strong lines or deep set rhytids already, something that's a little bit more genetic. Teeth grinding is something we commonly see.
Yeah.
I would say, so no, I don't necessarily judge anyone for wanting it in their 20s, and I have no problem supplying that if it's needed.
Right.
I love that. If it's
So
needed.
regardless, like regardless if you start in your 20s or if you start in your 30s, it's not really going to change what your wrinkles would potentially look like in 30 years.
Well,
Is
just
that
think of your face like a sheet of paper, and
I
every
did.
time the muscle contracts, yeah, you've heard me say, I've probably said this on a bunch of different podcasts and shows, is that every time that sheet of paper folds, that crease becomes more permanent. So, certainly in the 20s, you don't have that crease. And then, again, there are people that have stronger muscles in their 20s than people that are in their 50s. So everyone has a different muscle strength. Everyone has different cosmetic effects they desire. And I think that's my best assessment.
Yeah,
Okay.
and I know that this is going to be a very controversial question because it's like the topic is always controversial. I want to talk about injectables, Botox, filler, and pregnancy because I'm like I know that doctors will never do it, right? Like because of I just want to know like what are your thoughts on this? Does it really go into the bloodstream? Is it affect like could it like I just want to have a little bit more, even if it's completely and totally controversial and you can't say anything, but like I'm just curious.
Certainly, it's something that's highly debated.
Yeah.
And the reality is that there are a large number of patients who have been pregnant and not know it, or been pregnant and know it, that have gotten cosmetic treatments, and there is no documented ill effect on any pregnancy that I'm aware of in the world. Same thing with filler. And so, in general, physicians are trying to advocate for their patients and do the best that they can at the time, utilizing evidence-based practices. And sadly, there just is no data on either neurotoxins or HAs during pregnancy that I'm aware of. Hence, most
Yeah.
people shy away from it. Now, have I done it? Yep, I have. I go through a different consent process for that, and it's individualized to the client. So I'm not saying that I would do this for every pregnant patient, and it's a case by case thing, but I have not seen any ill effects of this, and I don't think anybody in the industry can speak to that. So
Yeah.
pregnancy is obviously a touchy subject.
Yeah.
Childbirth is such an important and incredibly beautiful part of life, and we would like to not disrupt that. And so, as far as white papers go, we don't have much to speak on, but as far as clinically what we've seen, these appear to be safe now. With what people would fear with filler is potentially not just the, I would say, the gel itself, but embolization with filler and getting it into an artery or vein anywhere, and even worrying for a second that could impact a fetus. That's a totally different ball game. But in terms of neurotoxin treatments, there is no harm that I'm aware of. But I'd say that's as delicately as I can.
Mm-hmm.
Yeah, of course. And like, is it would like, do you think that it's like depending on that trimester, it's more dangerous in like the first versus the third? Like, does that play a role in like your decision making, or is it just like patient by patient?
I wouldn't be able to speak on that, as I'm
Okay.
not. I don't
So
have the
you
knowledge
don't,
to speak to
yeah,
that.
okay.
I
Yeah.
would say that in the cases that I have done this, these are people that have previously had Botox during a pregnancy, and they're
Right.
coming to me, towards the end of their pregnancy, or, they're breastfeeding and they've had the treatment before with no ill effects. So this is something where they have a precedent.
Yeah.
And yeah,
Yeah.
again, that's my clinical decision making. I know there's lots of people that do it differently, that are more aggressive and less aggressive. That's totally
Yeah.
fine. But to answer your question, there's just no good documentation out there to support that it is in fact safe, and there's nothing clinically that shows that it is harmful.
Mm.
Right. Because there's also like women who do it and have no idea they're pregnant. So like it's like,
And also that people don't
so
study these things on pregnant women or breastfeeding women.
yeah.
It's not studied because of the pregnancy itself. So like the data
Right.
is
You can't study something that's going to be potentially harmful to the patient.
Right.
You would study something that's potentially beneficial to the patient for it to be
Yeah.
ethically sound.
yeah.
Yeah,
Yeah.
totally. Interesting. Oh, this goes the same for skincare, right? They're never gonna like test retinol or certain like
Uh,
salicylic acid. I know that those ingredients are like not recommended during like it's all the same. They're never gonna test it. But I was just curious because I know that it's definitely a touchy subject, but I'm sure there's a lot of women that have questions about it. So thank you for answering, even though I'm sure it was a little tough.
yeah,
No, that's fine.
it's very personal, right?
Yeah,
Certainly.
Yeah. Well, this is
I think
totally.
I think that in general, people typically get, this is a broad generalization, but oftentimes people that feel very, very strongly on something oftentimes are the ones that perhaps shouldn't be the one, they're entitled to that opinion, but I typically like to ask for advice from somebody that knows more than me, which I do in
100%.
almost every realm of life. And I'm always open to a different opinion. As if it's a better one, I'd be happy to change mine. So I would encourage people to not just be absolute with their thinking, particularly when, this would not be their area of expertise.
100%. Yeah,
very effective way to
totally
say that.
agree.
Yeah.
Yeah.
Thank you so much for today. This was wonderful. And I think
Yeah, we loved having you on again.
yeah,
My pleasure.
it's
I
been a lot of,
really got a lot of myths debunked, and I'm like, I feel refreshed about it. I'm like, I just really cannot ever refer to TikTok. And I'm just so happy this skin taping or whatever it's called, like, it's just not it. I was such a question mark in my brain.
Yeah, I saw you slide those that little tape on your desk into the garbage can as we were talking. So
No.
I'm glad I could help.
Honestly, like I was open to trying it. I was like, huh, like let me just see. Like I'm seeing it all the time. And I see it on influencers, content creators who are really passionate about skincare and use good skincare, do Botox, So I was like, okay, if they're doing this, then like maybe there's something going on. But I'm glad I have my answer now. So thank you for
Yeah,
that.
I usually would encourage anyone in general to, if you come across an influencer, I would understand the reasons behind them being passionate about something and
yeah,
Yeah,
be cautious with
good
that.
way to put it. Yeah, read
100%.
read between the lines.
And always just question everything also, right? Like always like ask questions, I think that's really
100%.
important.
A
Yeah.
100%. I at all the conferences I speak at every session, I teach. I really take pride in saying, listen, guys, you got to question, you got to think through things. And if I can't provide you an answer and something seems out of line, that should be a red flag. So definitely ask questions and make sure they're answered appropriately.
Yeah.
Yeah, which is
Yeah.
why we selfishly have this podcast so we can ask professionals like yourself questions all the time.
Yeah.
So
Now
thank you.
I'm gonna think about the threads now even more like seriously because I
Yeah,
kind of
you can go to Calgary and see Dr. Dargie about it.
no.
I'll permit that.
I
Yeah.
got you.
Thank
Thank
you
you
so much
so
for your
much for today.
My pleasure. I hope you guys have a wonderful week.
you
You
too.
too. Thank you so much for listening. If you enjoyed the episode, please take a moment to rate, review, and follow us on social at Skin Talks Pod. We'll see you next week.